Well, good afternoon, Eastern Kansas. Grateful that you're joining me today. I'm sharing with you today some of our focus going into fiscal year 21 and fiscal year 22, really our strategic direction. We've been through a challenging year. Thank you for all that you're doing. But as I look at our organization, we also have some challenges ahead of us. And I wanted to share with you some of the direction where we are going and need to be going, and some action plans. I first wanted to share with you our core services of what the focus is as we look to these future years. One of our core services is our high reliable organization journey and those principles that really needs to be part of our culture in all that we do. That just culture, that patient safety, that continuous improvement, learning organization, and engaging you as our frontline staff. I'm excited for that. We've made some great strides. Another core service is our whole health initiative. I say initiative, but it is really part of our culture of taking care of veterans. Because when you come here and serve our veterans every day, you're bringing all of you. And so we want to make sure that that whole health is part of who we are, employee wellness, wellness for our veterans, and you're going to be hearing a lot more about that as well. Another service that we have, which is really core to who we are, is primary care. Our veterans come to us every day and seek that caring and support, and it starts with our primary care team. And so primary care, our PAC team, our clinics in outlying areas really will be a focus that we can support and resource. Our next core service is behavioral health. How important is that? Critical, because sometimes wounds are hidden. And behavioral health and our experts in that field are able to talk with, communicate with, and provide therapy to those veterans who need those critical services. Another core service is geriatrics and extended care. Many of our veterans are a little bit older, and so we want to make sure that we have community living center beds available to them as needed, but other services that reaches not just our older veteran population, but all ages of our veterans. Another core service is our surgery programs here in Eastern Kansas. We want to make sure that we provide services within the surgery arena that our veterans can remain here in Eastern Kansas. We feel that as we focus on these core services, it's going to help us in a lot of different venues. As we've looked over our environment in Eastern Kansas and what we've been doing, we have had some challenges. We have a great staff. We've been looking really at three areas to focus on. Productivity, making sure that all of our staff are at the highest level of productivity every single day. That will open up access to our veterans and the care that they urgently and seek from us. Efficiency, we want to make sure that we're efficient, that we're utilizing those resources provided to us. And third is growth. We have veterans who have not sought us, and we want them to seek us and come to us and receive that care. We have opportunities to do that. Now, we haven't done that very well over the past years, and so this is what I'm petitioning you to be involved with as our frontline staff and our supervisors and our leaders, is to understand that we have to be ready to make some changes and transform Eastern Kansas. We've looked at some different numbers, what our workload has been with patient-weighted work, which allows us to really capture funds. We've seen those numbers, and we are lacking upwards of 8,833 patient-weighted work. That may not mean too much to you, but it really does miss the opportunity we need to be able to be at the highest functioning VA. I tell you time and time again, the trust value that we have with our veterans is at the highest. They tell us that time and time again. And so they want to come see us, but we need to do some things to be able to open up and see more veterans. So we have some goals that we've set around those areas, around patient-weighted work, around our FTE numbers, as well as around our growth. And we are currently about 2,000 employees. Our goal for this coming year is to decrease that to about 1,893. Another goal is our patient-weighted work, is to increase the patient-weighted work. And how we do that is making sure what we're doing, we're doing. We're coding it properly. We are closing those encounters, that we're documenting what we need to do. And we know that as we do that, we're going to capture more of that patient-weighted work, which will help us in the years to come. And the third is growth, increasing the number of veterans coming to see us. We have a pretty audacious goal of over 1,020 new veterans this year. I know we can do it. It's each one of us that needs to be involved with that. Talking to our veterans who may not be coming here to Eastern Kansas and encouraging them to come enroll. Those three things will help us tremendously in where we need to go. Part of this is budget. We are at a deficit, and we've been at a deficit every year. We want to work to decrease that deficit, and these are the things that will help us do that.